planning?
Thank you very much. So family planning from the water way already. Now a process where you try for plan your family, how many picky you want get, and who still you want get them.
Okay. So now, as this na process where you dey try for plan, let's look at the different types of family planning and way we get.
So in the process of doing family planning, you get education, and in that education they dedicate you on the options that where they are available. And the option they are available, different options in the you get the hormonal option, then you get the non-hormonal option. So in the hormonal options, you get medications where they give you, where they mimic the natural body system, because naturally for women them, so it might be very specific. Women and them actually they conceive and then they get pregnant. So in the monthly process or when they don't get belly, you get hormones where they produce. Those hormones they inhibit certain areas in the body where they make for men they don't get belly. So they can call it ovulation. Once someone don't get belly, they ovulate. So because they see say population they increase, so through scientific research they find a way where they go actually for curb woman not go get belly or for space, just as I mentioned, family planning. So in so doing so, the hormonal aspect of involves certain medications that we are saying. It can be a combined or a contraceptive where involve two medications then, which involve estrogen and progesterone. It can be progesterone only pill, where not only one set of medicine we get. It can be injectable, what they call depot. Then it can be intrauterine device, where not hormonal medication also, what they call Marina. They even get what they call patches, where they put them, they even ring hormonal medication in there. And then the non-hormonal them actually then a device the way they use also for make the woman not get belly. And then they can get still a copper teeth and they can get barrier methods them where they can also use, we also they as a non-hormonal.
So let's look at the hormonal one then where you don't mention when are the different who that's them supposed for taking any type of family planning in there?
Well, as you say, family planning it is for both sex, but most time actually because woman in then they get belly, so it's more easier actually for able actually for stop them for go belly rather than the man. Though actually in a man and woman they form, they get affair for form picking, we involve the sperm and the oocyte or the egg of the woman. But as you say that the woman get the uterus, we actually they conceive, where they actually take the picking or the picking start the picking the pulling down. So because of but most time a woman most time actually can come and can do family planning or.
But family planning they for man them.
It is for man them also.
Like which one then so?
Well, for man them actually studies don't show say even the hormonal medicine I don't talk about then they give them. But as I mentioned, the man actually get what to call testosterone at the male hormone. So one way actually they do that one they basically they get medication the way actually then they on trials and many trials in day. So when they give them medicine, they stop testosterone for lead to actually the formation of sperm, because testosterone is needed for spermatogenesis, the process of sperm formation. But most of those medications don't they try, the side effects so high. Okay. Because testosterone only the number for sperm production. Now it's responsible for give man muscular appearance, that rigid voice when man they talk. As I talk to you, voice is heavy, woman voice not heavy. So once you inhibit that testosterone, you will find out say the man they get a lot of side effect them. But medication then they actually we they will not go mention all. We actually do for inhibit the hormone at side. But you get also other means when surgical means where you can also do for the man. Because for the man, you get a process where the sperm they move from the testis and specific area where sperm can store, where man get sex. The sperm get for travel to a conduit, so they can do surgical procedure where they tie that side, so that the process of sperm moving and met it give belly and not gonna happen. So they get surgical area they can do for man apart from the hormone as I don't mention. Then we do also in a form of contraceptive, but not to a very reliable form. Okay. We probably you get sex then you try for withdrawal. So those actually are the other means where man also can do for family planning.
Okay, still on the hormonal type of family planning, you mentioned different types of family planning them. So now let's look at in the area of this injection where they can call Diplo also.
Diplo-Provera.
Yes. So is it that type of family planning they now for possible we don't begin for born or for post we not begin for born it, because sometimes they say you need to take family planning where you not start it for born.
Well, first of all, you get benefit of family planning. It's not just there for post where you don't born or post we not born it. You understand? So one of the benefit actually for woman we don't born we want space in Peking, you can give them family planning. It also did basically in case the woman not even born it, but it gets some gynecological conditions like abnormal uterine bleeding, or with the mess the heart harm, like endometriosis, adenomyosis, or it gets some ovarian cyst as the case may be. And so some of the benefits as I mentioned, one not to just more for make woman born not born, it also did for two gynecological conditions. If woman get fibroid, where they make it they mess too much, you can give them hormonal therapy for able for curb that bleeding day. If a woman get even cancers, there certain cancers we don't show say when you give hormonal therapy to the woman, it able help actually for curb them like ovarian cancer, endometrial cancer, but not cervical cancer at all. So you can also use that. So not only nobody for the one who don't born, you can use them based on the medical condition where you don't go meet the doctor. Once it says say you need to forget and then you will give you.
So how important it be for before any girl picking or woman want for joint family planning for get advice from a doctor or any medical person?
Okay, so indications that they actually where you go and give hormonal therapy to a woman based on the medical condition we get. First of all, if a woman don't just born, so once you go actually for family planning, they get for actually take it easy. If woman we don't born with a kumbra less than 6 months, you don't go give combined over contraceptive, because by so doing you go dry the milk of the woman and the woman get for suck baby. So when you go there, basically, if you not possibly don't born, where then get the rule of 3 and rule of 6 where then they use. So other medications don't go give you, whether like progesterone or progesterone only pill, way more safer for woman. If it less than 6 months where it don't born, you can give them. But above 6 months, they combine or contraceptive can be more appropriate. You get implant that they can use, what they can call, what they can put at the arm. Also another form of contraceptive and progesterone implant, which you can give to the patient. That's for woman we don't born. But also for woman not born, you can use them. But before actually then decide for say which type of family planning will fit you, as I mentioned, one they get for take it easy if you don't born. But also you get medical conditioning they will then go and rule out by you. Because not because it's safe, but it gets small side effect. And we want to make sure say you not get some of risk factor that will lead some of the side effect that will be adverse on you. So once you go there, they go want to take a proper history. In the history for the you don't get some headache or migraine, you don't get stroke before, you get diabetes, you get hypertension, you get any other thing like liver disease. So the medical people will take that careful history and see, and from there they go advise you which of the hormonal therapy will fit you, will you go use. So as I say, you get the hormonal and non-hormonal. So they can look in either way what is best for you based on the counseling, then they give you what is appropriate based on your medical condition we get.
So you say after where woman don't born, when I can get a certain medicine or certain period where for take a family plan. What of the one that we just do abortion?
Yeah, so you can, well, for the one don't do abortion, then can use either way.
Okay.
Based on the medical eligibility criteria we set. As I tell you, you get to look at age, the person they smoke, weight are left out, hypertension, diabetes, if you don't get other conditions there. In fact, they get for do a proper examination on you. It's not just what you cannot, you don't say they give you. They go do a specular examination on you, they go do even breast examination on you, they go even do scan for see if you don't get any condition within the liver. Not that is that actually for reduce the side effect. But once you get anything in it, then they can make sure say you not give that in it. For woman we don't do abortion. In fact, now part of the package we call comprehensive post-abortion care. Because what thing will don't cause the abortion, it will be something like infection, something other condition will happen. And so you want to rule out that stigma by the patient. If you don't get abortion, no doctor no go see you, not find out what's the problem, then probably go get that belly back, pull back again. You know what that means? It's more psychological. And that can lead to call recurrent pregnancy loss. But so based on that, we can give you abortion. We can give you contraceptive or family planning, so that will help actually we investigate you and actually for reduce that stigma there, so that in case next time we want to get better, if we stop that medication there, you could get better without no problem. So that's as I tell you, based on your medical condition, what will fit you. But if you don't do abortion, if you belly don't prepare you, we say probably an infection and you get some abnormal discharge when they come. Because also, if you get too much infection, we're not going to give you some the other family planning like IUC the way you put, we're not going to give that day. We might decide based on the medical condition, the risk factor. Okay, so okay, we put you on combined or contraceptive, we put you on Depo-Provera, we put you on progesterone only pill. So that's what we can do for them. We don't get miscarriage.
Okay, so now look at the non-hormonal type of family planning. Waiting you refer to as non-hormonal type of family planning, then how the process can like and which kind of sets of family planning follow under than the.
Well, the most time after non-hormonal they will get like copper T, you understand? So in the copper T actually now a long reversible type of contraception where they can say they put coil per you. Okay. So as I mentioned, you get the hormonal type on Marina, you get the non-hormonal way in a copper T. In the last longer, once you put her, it could take around 10 to 12 years before you pull her. And the way they work is different from the way the hormone they work. Because the hormone they work by mimicking the hormone with the woman gets inside the body, by inhibiting certain factors then, right from the brain, the hypothalamus, the pituitary, and even within how they move now the tube and how implantation they take place. Now so the hormonal they work. But when you come to the IUCD, the non-hormonal, what I just mentioned, the way they work, once they put on, then they make the environment of the uterus more toxic for me, the pequeno implant day. Because once fertilization takes place in the ampulla, you get for calm within the 3 to the 6 and implant in the uterus. But once you get the IUCD copper T, of course you get copper. So they release copper ion, which is very toxic to the zygote or the fetus when they form for car implant. And also what they do, they inhibit ovulation and they delay the movement of the zygote from the ampulla for car implant. So now so in the work, we're quite different from the hormonal, when they work by inhibiting the hormonal system where the woman get naturally so that the woman will ovulate.
Okay, the program now, well, Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. And name now Dr. David Jallo, in a specialist obstetrician, gynecologist, and senior registrar at the University of Salon Teaching Hospital Complex. And today inside the program, well, Body Talk, they also for talk about family planning. Options, the myth, the facts, and safety. Remember, say yourself where they listen and watch you live on Facebook. You will get a chance for be part of the program by way go send a comment or text message to the number 077981981 or self you go now Radio Democracy Facebook page. Where later on inside the program, where the open phone line, so people will call the number 077981981, 077981981, and the number where you go call later on and ask question about the topic we deal with today when our family planning options, the myth, the fact, and safety. So, Dr. Jallo, don't talk about within our family planning and the different types of family planning. So now let's look at plenty time we don't hear people they say, oh, I take this injection. Now this they do me. Look at the side effects of the type of family planning and they.
Okay, thank you very much. So long we talk when you first start the family planning.
Okay.
Because if you not start them properly, then it not go work for you. Because you get failure rate based on how you use them. So for instance, the combined or contraceptive, how you can use them. You can use them basically when the woman they doing period from day 1 to day 5. So that it will get potent hormone in the system for make a able for protect you during the cycle, the present cycle you're in. So normally you start and let me say from day 2 or day 3, and actually made up of 28 pills. You get the free hormonal medication when at 7. You can see some white, some sideways red. The red are free hormonal. So that hormonal you take on 21 days, then you take the free one. So a right for making you take them every day, you know, for the miss. So if you miss them, then what will happen? You go bleed or you go say not fit you. But notwithstanding, every hormonal therapy gets only to side effect. Because the most potent of the hormonal therapy is progesterone. Estrogen day. So progesterone basically get in where they do, where they thin the endometrium. And the estrogen basically just did it for potentiate the efficacy of the progesterone. So what did happen? Because estrogen waiting the help now for help for make the endometrium go. Progesterone now for relaxer. So because you not get too much estrogen, what can happen? It get small bleeding. Okay. But that can happen maybe if the person is only starting for the first 3 months. But after a while, nothing will goes pass away because the system will work with them. So if you not take how you for take am, then it not go work for you, and you go begin see some bleeding will go happen. They go say, hey, what did happen? Because once you take am, in fact the way for take am, if na the combined oral contraceptive, if you miss am today, like you miss am one day, when you remember the next day, you dey take 2 medication. If you miss am for 2 consecutive days, then sooner you remember you for take am. Because if you not take am, it not go work for you. And not apart from the bleeding, then the family planning wey you want see you want do, it not go work. You go find out say you go get belle.
Okay.
At the end of the day, go say, oh, this thing not be fit me, because you not talk am properly, the right way for take am. So you not get enough hormone actually for suppress ovulation, and so belle go take place.
So how person go know say na this type of family planning fits me?
Well, as I mentioned early on, you get expertise in all the government hospitals there. Where me dey work na PCMH, we get a family planning unit. I think all government hospitals are know of, and even some private hospitals, then get a family planning unit. So once you go there, you get what to call medical eligibility criteria. If you fall within a criteria, if you not possible they smoke too much and you age don't pass 35 years, we will know which kind of medicine we will give you. If you not possible get hypertension, we get blood disorders there, we will know which kind of hormone therapy we will give you. If you not possible get liver disease, acute one, we know which kind of medicine we will give you. If you not possible get like myocardial infarction, we know heart disease, we know which kind of medicine for you. Because no one give medicine where you actually increase the risks and the side effect. So now they will go to see based on those history we don't take, they will know say this one will fit you, this one will fit you. So now something like when they force you on them, but they give you all the teaching and everything, then you go say, okay, doctor, I want to take this one. The one thing I want to mention also, I left out, people that want to see this I pill not to a effective contraceptive. Now a temporary just contraceptive they use, not to a permanent something, because it need fully actually suppress the ovulation system.
So meaning they try for say if you take I-pill for prevent itself, you need to work?
Yes, so because people don't want to say using I-pill na a form of contraception. No, I-pill are just emergency. In fact, I-pill you dey use them in case probably you get unprotected sex, you go and use them. In case probably you dey use condom, the condom break, you go and use them. You dey use I-pill in case you use combined oral contraceptive at a time after you say day 1 to day 5, between that 10 days you go use the contraceptive for making able to protect you that cycle. But if you use that beyond that 10 days, it can still work, but then you have to use emergency contraceptive pill anytime you get mommy and daddy business for make it work. Because if you take them beyond 10 days, you don't get enough of the hormonal medicine inside the systemic, the circulation. So you find out say it go fail you. They say, that medicine they give me fail me, not work for me.
So Dr. Jallo, how person they use I-pill?
Well, you use that within 72 hours after you get sex, especially within your ovulation period, or if they use a contraceptive means where they use, where probably you not take the medicine accordingly. You miss an 210 or 310, then you feel say it will work for you. You can still take the medicine as I mentioned, but then if you use an IP for at least 7 days so that it will protect you from any better.
So I-pill na other one way some people refer to as emergency pill. Let's look at the safety side or the effects where it gets on that day.
Well, I-pill from your experience, you understand? Well, it can cause what you call amenorrhea, where you menstruate disease, especially when you take them based on the time of your cycle. Because you see, if woman in cycle they in phases, you get the menstrual time, you get the time where you get follicles where they form, you get the mid-cycle, you get the secretive phase. You understand? So within the ovulation period where the eggs them actually for the woman, they come out from the ovary and can they move within the tubes. And during that time a day, if you take I-pill, of course, it can protect you. But not forgetting that also now a process when they take place in the body. You hormone and during that time a day, estrogen, progesterone, then they in the high level for help you for me ovulate. So at times when you take and you find out say if you meant supposed to come the 5th, you don't go can't take the 10th because you don't take some medication. We also don't go disrupt that process day. And what you do also because the way they work, IP they work, it they stop the movement of the egg from the ovary or from the tubes them. So by so doing, in some few cases we don't treat na PCMH. When we take a proper EC, the patient tells you I will take IP. And later when we diagnose and we find out say get ectopic pregnancy. So you have to be very careful how you take them and which time of your cycle you take them. and you not get for the take am all over all the time. After every sex, you want to take am. After every sex, you want to take am. So, I mean, we advise you just use them twice in a month, not more than that. Use other means, either condom, barrier methods, as the case may be.
Okay, the program now, well, Body Talk, they come to you live from the Society for Any Democracy 98.1 FM. Today inside the program, well, Body Talk, we talk about family planning options, the myth, the facts, and safety. As we get the experts in the studio with we, when our Dr. David Jallo, in the specialist obstetrician, gynecologist, and senior registrar at the University of Salon Teaching Hospital Complex. And yourself can be part of the program by why you go send a comment or text message to the number 077981981, or if you go on our Democracy Facebook page. Later on inside the program with the open phone line, so people go call the number 077981981, 077981981, and the number where you go call later on at the program. Ask question about the topic what they did with today when our family planning options, the myth, the fact, and the safety. So Dr. Jallo, now look to the myth, and plenty people they say, oh, when I take this type of family planning, it don't make a own bump, it don't make.
Well, actually, now one of the side effects, Danny, because the contraceptive, especially combined or contraceptive, they in generation. You get the first, the second, the third, and fourth generation.
Okay.
So the generations actually, because as I say, it made up of two drugs. You get the ethyl estradiol, and then you get the progesterone aspect. As I say, the potent is not the progesterone. And what in progesterone? The progesterone is analog of testosterone, where they produce androgen. And androgen get what you call antidiuretic effect. What you mean by antidiuretic effect? It they make you know they able wet better, or they retain water in your system. So what they do is that some of the side effects now weight gain, what can happen. And it depends on the generation of the drugs that we use. If you use fourth generation of drug, the amount of ethyl estradiol is high. As you go up in the generation there, it low. So like the latest fourth generation then, that side effect they win a retention of water, not there too much. So that bump is not gonna happen. But yes, it can make woman bump, it can increase the lipid, as I say, that make could do all that testing for you, so that in case you get some condition then, we will know what to forgive you. But it's part of some of the side effects can happen in some woman then, because now so it will work.
Family planning gets anything for do with his sexual desire?
It's not get nothing for do with your sexual desire, because it's an exogenous substance where they actually just for modulate and mimic the natural hormone the woman get inside the body. But when it comes to libido itself, basically, that's a whole different setup, because you get hormone responsible for that, and they really make you get that desire. It not get no effect. All what to do is for prevent, may not get belly, for treat gynecological condition, like a woman can get what you call polycystic ovarian syndrome. If you get endometriosis, adenomyosis, you get fibroid, you get some big cysts, you can treat her. But you don't get nothing for able to affect your sexual desire.
So now to say if woman take family planning, plenty tell them I don't get below but join family planning.
So the first thing I will ask them first is, how you they take this family planning first? Tell me if you take and win. Because as I tell you, people don't take accordingly. Because
but what the one way take injection, ki say oh na family planning na fail me, but it they take injection.
Well, sometimes you not go back for take the injection, because once you not take and the immune system very powerful, and they come back to the normal. You understand? But if now you know the tablet you take them accordingly. Yes, you get failure rate very minimal, but if you take them accordingly, you always look. You better not go come, because you not take accordingly. If now injection you take, of course that 3 months, you get forget every 3 months you take them, because it is suppressed and get out of the work. You understand? But if you take the 3 month injection, wait for go take them back, you no go. Then you wait back, say okay, I wait after another 3 months to go. Because that go happen, because you don't get any answer that the natural system go work and that go take place.
Plenty tell don't you say where woman they go for take that coil when are the non-hormonal way, just when they fall under, and they say you for no force the size of your man of your penis before you go take them, because they say if they get sex they push for going sideways. Like you say in a danger, not true?
Well, no, you're not getting nothing for do to that, because you see, the dark coil actually feel like T-shape. T-shape. Either the hormonal or non-hormonal, also by T-shape. And what actually come on a thread, that thread we can show out actually now for just specially so that in case you want to remove the coil, you could just hold on that thread and do it outside. But you're not getting nothing for do to that one day. So because the way they added they fix them, people then train at the hospital have to fix them. Once you fix in the proper way, it will work the way for work. So you're not getting nothing for do with sex or whatever the man in penis as the case may be. You're not getting nothing for do that day.
Okay, so now let's look at if person don't take family planning, then one stop for take family planning, say, oh, now I don't decide for get belly. Let's look at the period where it would take that woman day for making go get belly.
Well, it depends on the types of family planning we they take. Because if now combined with contraceptive, once you left farm, within the 1 month, you natural hormone in your body, when the estrogen progesterone, where they produce from the ovary, and when you get all that thing them back inside the body, then they take up the system. I go say within 1 month, 3 months until you go get belly. But the Depo-Provera, that injection, basically, yes, it can delay ovulation in some cases then. You know, because it will suppress the hormonal system inside the body short away that even though I will not take against it, for make it belly, it will take a little bit while. But naturally it pass out, when it pass out from your system, then you go get the belly. But if it not happen, then probably you need to go back, make them evaluate you. Let them look at other hormone because not to just a single hormone actually responsible for me woman get belly. A lot of hormone in there we combine together. You can look and carefully based on the test that you can say, now this one get problem, make a treat them.
Now look at the different family planning method there. Way is it that for take the long term or the short term or the short term method?
Well, we can take a good history because, like as I say, me the PCMH will do a lot of cesarean section. If a woman don't do 2 or 3 or 4, 5, or let me say 4 cesarean section, you get a role basically as a doctor for advise that woman. Either you do a permanent form of irreversible contraceptive, you could tie the tube. If I left down the out also, I left out. Then, or you can use a long term because someone they say no, I don't want me to tie me tube. I don't want me to tie me tube. I don't want to take hormonal medicine. You make my body big. They say okay, we'll use the long term reversible. When are they IUC the way you put when are coil. But the irreversible one, that the tube that they block completely. That they don't get belly again. Because they do one basically, you know what made the woman continue to get repeated belly, where they increase the risks for make it get complication in that belly day. Either PPH, rupture uterus, or some other complications that basically we could happen to the pikin. And even for make you deliver can be difficult.
Okay. The program now, well, Body Tok, they come to live from the Society for the Democracy 98.1 FM. And today inside the program, we talk about family planning options, the myths, the facts, and safety. And remember, say yourself can be part of the program by way go send a comment or text message to the number 077981981 or say if you go now already Democracy Facebook page. Later on inside the program, with the open phone line, so people will call the number 077981981 077 79291 and the number where you go call and ask question. But the topic where they deal with today when our family planning options, myth, facts, and safety. Well, now na time for make we take break na the program. Daily courage. No condition. The condition is permanent. Yeah. 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 Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you.
no condition.
The condition is permanent.
Cause no condition.
The condition is permanent.
Cause no condition.
The condition is permanent.
This is J-Bank's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah, no condition is permanent. You never know if someday you will find yourself in that same situation. In this life, you feel today, tomorrow is not promised. In a twinkle of an eye, your story might change. Be you black or white, no matter your personality. Be you rich or poor, your story might change.
The program our Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. And where they bring you this edition of the program our Body Talk, my name is Kaifa to Conte. As today inside the program, we talk about family planning options, the myths, the facts, and safety. And today we studio guest now Dr. David Jallo, in a specialist obstetrician, gynecologist, and senior registrar at the University of Salon Teaching Hospital Complex. And remember, say yourself where they listen and watch you live on Facebook, you go be part of the program by way you go send a comment or text message to the number 077981981 or self call the number 077981981 077981981 at the number for call and ask question. But the topic what they deal with today when our family planning options, the myths, the facts, and the safety. So, Dr. Jallo, let's look at the age group way for take a family planning.
Yeah. So, you get actually women within the reproductive age group between 15 to 49. So, even teenagers themselves, you could do family planning for them. As we say, planning of family actually not for everybody. But we get situations where they get teenage pregnancy. We're very common, and I think that one of the problems now they're not only in a salon, they're all over the world. So I think we get reproductive wing, and so most time like for teenagers then, where they below 19 years, 18 years, you could want to get a family planning. You don't go want you 15, 16-year-old whether for be doctor, lawyers, start for give birth uncontrollably. So looking at the complication we involve with some of them teenagers they get belly, they go get obstructed labor, preeclampsia, they will even get fistula when a communication between the uterus and the vagina where they go to leak water. So you want to get something where you go for plan for them so that they don't get. So there's also, but you know they do just in that way. You get for take consent. So most times they go for the antenatal. We will see them. We say go call you mama. So once the mama did, they will educate and say we need for do some form of family planning for this. And we can do education them. They will know what's appropriate or we find for them. So you can use that with all age group as I can say. So family planning also basically the processes. Not only for between 15 to 49.
Okay. You
can use that also, though the medications that also they use for family planning can be used in what we call menopausal replacement therapy. If women don't go past menopause, because during menopause your hormone, the estrogen, progesterone, they need a very low order. So some people call that hormonal replacement therapy, but it's actually menopausal replacement therapy. You understand? So you can give a very low dose, not a very high dose. You understand? Not for plan family, but for just cope the side effect of the menopause. When they get the hot flashes, they can even get bone pain, they can get all type of side effect. Even they can get some genitourinary syndrome, which sometimes when they wear it to the bones, they get itching, anything. So you can still use that in a very low dose for help them. So you can use them depending, but when woman don't pass 60, you not to use them because the risks of the side effect for complications is very high.
Okay, we'll go look more to the side effects and they will don't get to first call on the program. Hello, good evening. You name and inside the call for.
Good evening.
Yes, good evening. Come on your radio, please.
I will call from West Carroll.
Okay, go ahead and ask a question.
we could just talk and say, I just want to know the location of this hospital here. Because I want to check that one candy. I just want to know the area of the location of the hospital.
Okay, plenty. Thank you. The doctor will be able to respond to you. The program now will Body Talk. They come to you live from the Society for Radio Democracy 98.1 FM. Call the number 077-981-981, 077-981-981, and the number where you go call and ask question about the topic they deal with today. When our family planning options, the myths, the facts, and safety. What you want for know about family planning? Waiting at the different types of family planning. The way you don't take ways to say don't get side effects. Call now and ask question. We don't get another call now the program. Hello, good evening. Your name and inside the call phone.
Hello.
Yes, good evening. Fine, sir.
The last talk with this guy talking, it's like it happened to me. I don't know how.
Like waiting. Please come on here and tell you like waiting.
Wait, they went to the pillar.
Okay.
Yeah, the same thing.
Okay.
So,
Plen-
I want to give me idea about that.
Okay. Well, the doctor will start. The program now will Body Talk. They come to you live from the Society for Radio Democracy 98.1 FM. Call the number 077-981-981, 077-981-981, and the number for call and ask question about the topic where they do it today at the program. Hello, good evening. Name and inside the call from. Well, we don't lost that call at the program. So, Dr. Jallo, yes, the first one they ask say inside the hospital day.
So actually, we hope na PCMH. We are the main referral hospital for all Belgium business in the country.
Okay.
So notwithstanding, we get government hospital there within all over the country. So USA in there may just locate any government hospital and go there and go to the family unit side. They can address them. If you want to PCMH, you can go educate them, address them, and tell them what you appropriate what you want.
Okay.
Then for the last call, I did say
woman the wet.
So what are the woman age first? As the last what I mentioned lastly was that the benefit of hormone basically they also use them for women who don't pass menopause, not just for plan for picking. So if the woman they wet they get pain based on the age group, okay, consulted this year. Most likely again urinary tract infection. So you need to go and do urinalysis, culture and sensitivity. Then they can put on the appropriate medicine, as you can see. So when you say the heart, it go once take a proper history and know exactly what they happen to one. If you are not to menopause, you don't pass menopause. If you don't pass menopause, now be the time for talk about say it can happen. People don't pass menopause, they can get some problem with the weight, it go pain them. Because the estrogen they play a very important role in the woman. And they work all over the system. So once the woman don't pass menopause, that hormone they carry begin get all them funny side effects here. So that was what I was talking about. But based on the human age, you need for kind of hospital, they okay, but address the situation appropriately.
Okay, the program now with Body Talk in a come to you live from the Society for Radio Democracy 98.1 FM. Call the number 077-981-981, 077-981-981 at the number for call. Or self you go now Radio Democracy Facebook page and drop in your question there where you get at the topic what they do with today when our family planning options, the myths, the facts and safety. No flash the number, call the number 077-981-981, 077-981-981, now the number for call. So Dr. Jallo, look at for how long we person for the use family planning.
Okay, so actually based on studies what they don't do actually. Well, you get a short term, you get a long term. You understand? So as I say, once you go to the hospital, we get what you go appropriate for you go take for long based on the medical eligibility criteria. So you don't find from a woman just begin no more because in party they take contraceptives, say go begin take them. So go to the expert, they may they advise to talk to you. Because based on your medical condition, as I say, if not combined with contraceptive they give, we get for check. We get for check your breast, any history of breast problem, breast cancer, any history or any breast disease condition we get. We get for do a specular examination or do a pap smear for screening you for cervical cancer. Because if you constantly take this hormone therapy here, after probably 5-6 years, it will begin to get effect on the present risk we get is we get, it will even pronounce for me get cervical cancer. Breast cancer is debatable. Some are say it can give breast cancer, but also depend on if you get the risk when you take them for too long, because you're going to begin get the signs and symptoms. So if you take them for too long, maybe 5, 9, 10 years, then you will begin to see the marked side effect of them. But as I say, once you go to the hospital, probably not for free, we can for look a lot of risk factors the way if you get them. Then we can give the appropriate one so that you're not going to get those problems for camper you, as I mentioned.
The program now, well, Body Talk, they come to you live from the Society for Early Democracy 98.1 FM. And today we talk about family planning options, the myths, the facts, and the safety. So call the number 077981981, or if you go to our Early Democracy Facebook page where we don't get another call now the program. Hello, good evening. Your name and where you call from?
Yeah, good evening, Carissa. Mina, the call from UK. And I just want to ask you things or mention a few things in terms of Dr. Nabi studio. Regarding one, I don't know if you observe when women don't born, when you can gain weight because of the fall of the progesterone and the estrogen level, they fall, and the increase in level of prolactin. That prolactin level, they make the woman, when you see don't born, see they gain extra weight. But I don't know during the period of the pregnancy, after the first, second trimester, how they go able for monitor, if they can get anything for adjust and just like what they do for that hormone replacement therapy where you talk of, if they get anything in place. And then secondly, just I don't know, for men, demand them, I don't know if they don't begin to vasectomy for men, operation for cut out the vast difference, what would have vasectomy, if they do them now in the salon, or on those stages where they can recommend for doing back if at all then they do them. But that no more. Thank you very much, and let God continue for helping our good work. Thank you.
Okay, plenty. Thank you, Swell, for we call and make your contribution and self-ask question at the program. The program, well, Body Talk, they continue. You self can be part of the program, but I go call the number 077981981, or self you go to our Democracy Facebook page. As today we talk about family planning options. So Dr. Jallo, can respond quick to us.
Yeah, I hear they say hormone replacement therapy. We know they do hormone replacement therapy for women who get belly. And when women get belly, estrogen progesterone they increase because why? They play a very important role in the uterus for growth, in the breast for growth, and because the uterus now get for only picking. So if you now grow, it just do so no more. How the picking go? They pick will go be certain 3.5, 3.6 kg. So they grow in size and they grow in tissue. So a measure of prolactin is say when the woman not go, the woman they become big as things to be. First of all, when woman get belly, there is an increased metabolic activity. So lipid concentration they increase, fat they increase, you understand? So because the woman get for eat. If you not eat, how the picking will go inside? They get for put on weight, you understand? So that issue of pelvic growth, where they say na growth, maybe not just fat accumulation when they happen to the woman. So the issue of prolactin not get anything for weight. What thing prolactin get for do in some study don't do is that prolactin in some woman they cause cardiomyopathy. Where the one who that cardiologist will get, of course, get a big cardiologist, Professor Rose. So when you see that situation and they will not say you get them and you breastfeed, we can send it to them. May go investigate to find. But prolactin has nothing to do with actually weight gain. What if prolactin get for do for a woman, now for help her for make the breast milk come out? Production of breast milk. Now you hold that one day. What prolactin they do. And not only prolactin they do them. The estrogen, progesterone, talk, they're all apparatus so they help for build up the breast. And once that pikin don born, what they happen? Prolactin go begin for rise up if the pikin they suck. And not go rise up if the pikin not suck because it they rise up based on the stimulus when are the sucking reflex. When the pikin they suck, I they suck now so prolactin increase so that breast secretion for take place. But you not get nothing for do to it.
Okay, so you also talk about vasectomy for
yes.
man.
So vasectomy actually is a surgical procedure where the vast difference you the obliterate you the block out. So that sperm no go travel from the area outside sperm they produce and pass to where the man and the woman they get married that business.
So that's another type of family planning for man.
Well, yes, now family planning for man we mentioned earlier on.
Yes.
Probably I'll not put and say a vasectomy.
Okay.
But I can say, well, few men can undergo them. But I can say most time women are more than they can do the contraceptive means. but not to throw way back, not to throw the damage any man. For see we do am. The only thing is sperm no go move. Only waiting go move now, only semen. Because waiting made up of sperm, you get waiting made of actually the entire semen, you get some sperm, then you get seminal fluid. The seminal fluid they produce is different from inside the sperm they come out. So the sperm they draw the seminal fluid for form the semen. And so what you go still they ejaculate, but no sperm no they do because don't block inside.
So una can get man then we can go for joint family planning.
I'm sure, as I mentioned, I say medication and they and try